Welcome and thank you for your interest in this, what I consider a very interesting project entitled The Prevention and Treatment of Cervical Cancer in Women of Ghana, Africa. We are from the Rotary Club of Eau Claire, and there are two of us here to do this presentation today. I'm Bill Klesch, and with me is Holly Hart. We've both had some training and interest in doing, grants and, in my case, working in the third world. Cervical cancer is a very important disease globally, and in 2020, nearly 350,000 women died from this disease. It is caused by the human papillomavirus, or HPV, and there is a vaccine now for HPV, but it's not very available yet in Africa, and it's only given to adolescents, and therefore it takes a while for the vaccine to catch up with the disease itself. A woman dies of cervical cancer about every 2 minutes, and in Africa, it's the leading cause of death by cancer in women. While many cancers are very difficult to address, cervical cancer is relatively easy if you to diagnose and to treat, but you have to detect it early. If it spreads beyond the cervix itself, you're too late. Providing a woman with screening and treatment in the early stages, costs maybe $4 to $10, but it's falling rapidly in Africa, primarily because of some of the techniques that we're going to talk about today. Only about 1 in 5 women of sub-Saharan Africa have been screened. And of those that have been screened, only a fraction can be treated because the small and medium-sized health centers don't have the tools to do the treatment. Thus, rural poor women, even if they are screened, are likely to be provided with treatment. And there are many obstacles to this. If treatment is in separate clinics from the one they went to, the distance to that clinic is important because most of these women have to walk to get to these clinics. Time away from income generation, if the women are working, is very important in these families, as well as the household chores. And spousal permission is a very important part of this, as I found out in Africa. In the United States, the prevalence of this disease is 7.6 per 100,000 women, and 2.2 women die per 100,000. The prevalence is decreasing because we introduced the HPV vaccine, something like 15 years ago, or maybe a little bit more. And that's beginning to take, to factor out some of these women that would normally get the disease. However, in Ghana, the prevalence of this disease is 26.4 per 100,000 women, which is 3 times that in the United States. The death rate in Ghana is a little over 17 per 100,000 women, which is 8 times that in the United States, showing the importance of a project like the one we are doing. Only 3.9% of the women in Ghana were screened in 2014, hence the increased prevalence of this disease and the increased death rate. There are global recommendations for screening and treatment of cervical cancer. In this country, we use the pap smear to make the diagnosis of cervical cancer and then treat it with electrocautery. But in Africa, Pap smears, since they require pathologists to read, and the electrocautery requires fairly expensive machines. It's impossible to do this kind of screening and treatment. There are very few pathologists in Africa. So the World Health Organization has recommended an alternative way of screening. They call it VIA, which I think is a silly acronym, but it stands for Visually Inspected with Acetic Acid. Basically, what you do is you swab the cervix with vinegar, and any inflammatory or cancerous lesion on the surface of the cervix turns white in color and can be easily identified visually. It's then treated with what's called thermal ablation, which is a self-contained battery-powered or electrically powered battery instrument. And there's a sort of a picture of it right here on this slide. This is what the thermal ablation device looks like. It's very simple, very easy to use, and is the timing of the ablation is all automatically controlled in the handle. You set the device for 30 to 60 minutes. In Ghana, and I should show you that this yellow country right here in West Africa is Ghana, has approximately 26 million people. We contacted, or were able to contact, Dr. Kofi Effa, who leads the Cancer Prevention and Training Center in Ghana, and is very well respected both within Ghana, but also by the World Health Organization and other organizations that he has worked with. He trains up to 14 healthcare workers using this screening method, and with acetic acid or vinegar, and at the same, and also with the treatment with the thermal ablation device. And he does this throughout Ghana and neighboring countries, but mainly in smaller cities and rural areas. He's looking for the poor rural women in the screening clinics that he has. In many countries, health services include cervical cancer screening and treatment, but they were halted or reduced during COVID-19. Interestingly enough, though, Dr. Effa increased the screening and treatment in 2020 and 2021, which kind of tells you how committed he is to this whole program. Health workers provide service in functioning health facilities that are provided by the Ghana Department of Health. And so the infrastructure, salary, and training costs are all covered by the health department. The main gaps in Ghana remain to be a total need for thermal ablation devices. If we did every district in Ghana, we would need 260 of these devices. The number of nurses, however, trained so far to use the devices are 170 in 120 districts. But the number of thermal ablation devices available to them at the moment are only 12. This leaves large gaps in the prevention and treatment of cervical cancer. That means there are 248 devices that are still needed to cover the 260 districts, but 120 devices are needed to cover the districts with already trained personnel, and only 12 are available. So 108 districts with trained providers have no devices. And that's where we come in, trying to produce or develop or give these devices to these trained providers. The costs of these thermal ablation devices at retail level is somewhere between $1,200 and $1,350. But we've found a discounted cost of $945 using some of the agencies that we've contacted regarding this project. We don't know what the shipping and custom clearance is, and that's going to be determined later as we're ready to ship these devices to Ghana. The cost per person treated is listed here. Each device has approximately a 4-year lifespan and treats 100 to 200 people per year. That means that the cost per person is only about $1.25 to $2.50. And if you get more out of each device, which I'm sure you can, that would even be less cost per individual person. We have contacted other organizations, that this the first that are connected to Dr. Effa, and that one in our group knew. One is the Together for Health organization, and which one of our group knew Selena Shakin, who is the founder of that board. She has been very helpful in giving us advice how to purchase these instruments. We are connected with the WHO Cervical Cancer Elimination Initiative through Dr. Effa, and researching potential through them for further price reductions. And we are connected with 2 manufacturers of the approved devices. We haven't decided which one to use yet. Other partners working in global cervical cancer, and these are kind of nonpartisan partners, are the George W. Bush Presidential Center for the Go Further Initiative and the Clinton Health Access Initiative Cervical Cancer Program. I've worked a little bit with the Clinton Health Access Initiative, and I found them to be a very good group to work with. As we plan this, we already have developed a host club partner, which is the Rotary Club of Accra East. Accra is the capital of Ghana. And we have already submitted a 1-page summary to District 6250 Foundation Committee and the Rotary Foundation to get preliminary approval for this project. Our total commitments from our particular Rotary Club is that we've raised somewhere in the range of about $35,000 from the Eau Claire Rotary or Noon Rotary Club and the Rotary Club of Accra East, who has thrown in a couple of $1,000s. Of course, district and the World Fund includes matching funds for the money we've already have raised, and that's included in this $35,000. With the committed funds, the project will cover procurement and delivery of approximately 60 thermal ablation devices, a little bit more than half of the need amongst districts of trained providers. And hopefully there will be another project that will fulfill the other half of the devices that are needed. With this, I think I will turn this over to Holly and let her talk a little bit more about the funds that we're trying to seek. And Holly, the floor is all yours.
Thank you, Bill. Dr. Cleisha is our medical advisor, and it has been just invaluable to this process. We are seeking additional funds. We're seeking about a total of 70,000 for the grant. That would include the district funding and the Rotary International funding. We look at using 35,000 of it in a phase one, where we would send half of the devices, get them out and get things going to the districts and then evaluate. And then we would send the second half out in a second phase. We're hoping to procure, as we said, 60 devices. In combination with the 12 devices they already have in country, as Bill said, we'd cover up to 50%, 56% of the gap that we have. That means we've got about $11,000 to raise. And so we're going out to clubs and asking them to think about whether they would be interested and could commit funding to this project. As Bill said, $945 covers one device. And we're reaching out to the other clubs. We're doing fundraisers ourselves. We would be sharing progress reports back with clubs that are interested in participating. And we hope to encourage other clubs to keep filling this gap. It's a great project. I'm going to turn this back over to Dr. Cleach and let him summarize for us.
Well, with that, I hope that you would take an interest in this project. It's a wonderful project, and will do great things for the women of Ghana. And with that, we will end this presentation. If you have any questions about anything, you'll have my email address. You can email the questions to me. I'll be happy to answer them. Or if you need to do it by telephone, I can provide you with my telephone number. So thank you very much for listening. And with that, we have come to an end of our presentation.